Please welcome Cleveland Clinic CEO and President and the holder of the Morton L. Mandel CEO Chair, Dr. Tom Mihaljevic.
Good morning, and thank you very much for coming. This is indeed a special morning, as we are honored to welcome to Cleveland Clinic the Surgeon General of the United States, Vice Admiral Dr. Vivek Murthy. Dr. Murthy has served in both Biden and Obama administrations in his current role, and he's a renowned physician, but also educator, research scientist, author, and a very passionate person when it comes to health of our nation. In his role as a nation's doctor, Dr. Murthy leads the national response to urgent public health care issues, which we have many to be concerned about. One of his focuses, however, are pretty much aligned with the focus of Cleveland Clinic, and that is a focus on growing mental health challenges that affect children and young adults. And this is something, as I mentioned, that we share as well. Our country's young people are dealing with unprecedented stresses, everything from social media pressures and gun violence to the pandemic's ongoing impact. Dr. Murthy is currently on a national tour to bring attention to this important subject, and we are so glad to have an opportunity to participate in the conversation with our Surgeon General. Please join me in welcoming Dr. Murthy. Good morning, and official welcome to Cleveland Clinic.
Thank you so much. It's good to be back again. I have very fond memories of my visits during my last term as Surgeon General, so thanks for having me back.
So how's your second term as Surgeon General been?
Unexpected, I would say, to start with. You know, I'll tell you, I didn't plan to come back to government and serve in this role, but you know, life happens. And what happened to me during the pandemic is I ended up spending a lot of time then with then Vice President Biden when he was, thinking about the pandemic and thinking about how to respond to it, and would brief him regularly on the pandemic. And at some point, toward the end, just shortly before he was elected, he said, if I'm fortunate to have the opportunity to serve the country, we've got to do something about this pandemic together. And it was at that point I remember having a conversation with my wife, and she said, okay, so if you go back this time, what's going to be different from the first time? And here's what she meant. And those of you who, because I had, let's just say, a few personal shortcomings the first time around, in that I had a terribly lopsided balance when it came to family life and home life. And this is what I regard as one of my personal failures, during my first term, was that I really did neglect a lot of my relationships and didn't do enough on the family front. And so that's what she meant when she said, what's going to be different? And so we made a real commitment that we would find that right balance, especially now that we had two small kids. And I'm grateful that it has been much better. And I knew that because she said to me the other day, she came up to me and she said, you know what? I don't hate your job this time around. So I took that as a great sign of progress. But it's been an extraordinary opportunity to come back. And it was a big decision, but honestly, it wasn't a hard decision. Because like so many of you and so many of the people we know, during a time of crisis, we all want to be helpful in the way we can. And it was, there was a part of me on the outside which felt like, gosh, I know some of these levers which I think we could be pulling in government. I want to be able to do more and serve more. And when I was given the opportunity, it was a blessing. So, I'm glad to have the chance to be back. But in addition to COVID, though, the biggest thing I did want to focus on, the issue that had concerned me actually from my first term as Surgeon General, was the issue of mental health and well-being. And so that's why I'm so glad that we're here to talk about that today.
Well, so are we. So let's just speak about that a little bit. And the mental health issues were present before COVID, obviously, but then a COVID exacerbated mental health crisis worldwide, in particular our vulnerable population, children, young adults. So could you please share with us how are you viewing this problem, and equally importantly, what do you think that we as a nation can do better?
Well, I do believe that, while we have many public health issues that the country is struggling with right now, that mental health, I believe, is the defining public health issue of our time, not only because of how profoundly it is affecting children and the broader population right now, and I'll share the extent to which that's happening, but also because of the spillover effect it has on so many other dimensions of health. Many of you who are clinicians here in the room today know that when a patient is struggling with their mental health and well-being, it impacts many other dimensions of their physical care, the likelihood they may go to follow-up appointments, that there impacts potentially their medication adherence. It impacts so much of how we think about their care. And that was honestly something I came to understand the hard way when I first entered patient care. Sure, like all of us, I had some basic training in mental health, not that much, to be honest with you, in medical school. But when I came to practice medicine, I realized that while somebody may be coming in for a DVT or for lobar pneumonia or for the complications of an MI, there was often mental illness in the background that was ultimately impacting my ability to deliver care and for us to take care of them longitudinally. So for all of these reasons, mental health really is profound, but I'm particularly concerned about our children. Yeah. And there are always three numbers I keep in my head to remind me just of how serious the crisis is with kids. The first number is 57. That's a percentage increase in the suicide rate that we had in the decade prior to the pandemic among kids. Again, in the decade prior to the pandemic, and the pandemic for many children has adversely affected their mental health. Yeah. The second number is 46. That's the percent, or 44 rather. That's a percentage of high school students who say that they feel persistently sad and hopeless. Now, middle school, high school, these weren't easy times for many of us, and I suspect middle school in particular is a time of our lives when many of us may want to cancel out. But the truth is, high school is a time where we hope that even though life is hard and there's a lot of demands on our kids, that they'll be looking forward to the future and feeling optimistic and excited about what's to come. But nearly half of high school students do not feel that way. And the third number is 11. That's the number of years on average that it takes a child from when they begin to experiencing symptoms of mental health disorders to when they actually get care. 11 years in the United States of America. That's an extraordinarily disturbing number. And so this crisis is real, and we've even seen recent data that's come out from the CDC showing that nearly 1 in 3 girls in our country have considered taking their own life. That nearly 60% of girls feel persistently sad or hopeless, and young boys are going through their own separate crisis here as well. So our kids are telling us through stories and through statistics that they are not well, that they're not doing okay. And it doesn't matter how gleeful or cheerful the posts on social media seem to be. That's not always real life. And what's happening is that parents, including probably some parents here, are seeing things happen in their homes in terms of despair and the pain that their kids are going through that are absolutely profound. And Tom, this is one thing I do want to say is, as much as I care deeply about youth mental health, I'm also very worried about parents. Yep. Not only because their mental health impacts the mental health of their kids, but because parenting, which was never a walk in the park, before COVID-19, has become incredibly difficult. And we, I think, don't often pay enough attention to how much parents have taken on, having to manage this mental health crisis, the technology that our kids are using, technology that they barely understand themselves because it's rapidly evolving, while managing the changing expectations of what kids need to be successful in the future. So the truth is, kids don't operate in a silo. They live in families, they live in schools. And if we are not supporting families, if we're not strengthening our schools to provide the fundamental tools that kids need to build healthy relationships and build a healthy life, we will not get to the root cause of the mental health crisis that's impacting our children.
Often when I reflect on the mental health crisis that was exacerbated by COVID, I always think about if the next pandemic were to come, what would we do differently in order to alleviate some of the stressors, in order to support our kids in a better way? What are your thoughts about it?
That's such a good question. Well, I think one of the things we have learned from this pandemic is just how profound the impact on kids is of disruption, right? Yeah. So many children experience disruption in their education. They also lost loved ones. We had more than 160,000 kids who lost caregivers during the pandemic, and that is one of the greatest traumas that you can face as a child. But we also saw that the anxieties and stresses around them obviously had a profound impact. Many kids, when I do roundtables with children around the country today, they tell me stories, and stories that are often deeply moving. I remember one child told me that he was a 5th grader, an elementary school student, but he said that during the pandemic, he felt like he had to grow up because he saw how stressed his parents were, how worried they were about their jobs. And he was struggling at school, trying to figure out what was going on. He was scared, looking at what was happening with the pandemic. But he didn't want to tell them because he didn't want to add to their stress. As a parent, you hear that, and it's heartbreaking, right? Who of us would want to see our child suffering in silence? We'd want to know, we'd want to help. But there were many children like that, who felt the stresses and didn't know what to do with it. And even today, as we come to a much better place in this pandemic experience where we have better tools and more knowledge, I still find that children are saying that coming back, that transition to coming back has still been hard. Many of them, including high school students, say it's almost like they forgot how to socialize in the ways that they did before, and it's been difficult. So I think if we were to ever encounter something like this again, a few things that we'd want to do, I think number one is to make sure that we are searching support early to our kids, recognizing that the mental health support they need and that parents need is going to be profound. The second is to ensure that all of the support services that schools provide that people may not always recognize in the public, but which I know you at the Cleveland Clinic know well, things like food, for example, and many kids who are food insecure depend on those meals in school. We'd have to make sure that assistance, comes quickly to children, because there are many kids who also experienced worsening food insecurity when schools shut down. And I think that the third thing that we'd have to recognize when it comes to kids is that doing everything we can to preserve and protect their community and their learning experience is essential. So many kids had a hard time with distance learning during the pandemic, including my kids, for example. It was incredibly difficult for me to get our son in particular, and for my wife and I to get him engaged, with distance learning. His younger sister ended up participating in all his classes and ended up being a standout student in his class, but what about him? So anyway, but this is very hard for a lot of parents. So I think what we would have to do is figure out how do we create the learning environment that kids can really respond to, even if they can't learn in exactly the same ways that they were learning, before a public health threat. And so these are things we learn the hard way. And look, I think there will be many books written on lessons learned from this pandemic. But the last one of the many that we could point out that I'll just underscore is also the mental health impact on all of us. Yeah. Because this is something we are still experiencing. And we see this actually in natural disasters. Right? When a hurricane or a tornado affects an area, long after the last home has been rebuilt and the last bit of debris has been cleared, people are still experiencing the mental health impacts. In fact, they often will, sort of running on adrenaline, not experience a lot of increased anxiety and depression in the throes of an emergency. But after it recedes, that is when those symptoms start to come in with force. And so understanding that means that we don't say, hey, everything is done with and we can just go back and snap our fingers and go back to quote unquote normal, whatever that is, but we recognize that there has to be a long tail of support to the population around mental health. And that means not just having mental health treatment services available, it means being able as a society to process what we have been through. Right? I talk to people so many times across the country who say, it feels like we just flipped a switch and went back to 2019, but all this stuff happened, and are we going to talk about it? Are we going to think about it? Are we going to process what it meant to us? Are we going to figure out if we're the only ones who felt this way? In a family, when we experience hardship, this is what we do, right? We talk about it, and we get together with our friends, we process together. We need to do that as a country, and that's part of some of the work that my office is working on.
So you mentioned something that this COVID has really uncovered so many issues that were existing before COVID that were just exacerbated through pandemic. And one of those issues that really surfaced in a very unfortunate and a very strong way is health inequity. So everything that we just spoke about, the availability to receive treatment, the availability to receive support, even the availability of digital media to participate in education, then those are things that are not universally present. And therefore, whatever challenges we may have as a nation when it comes to public health, those challenges are disproportionately severe. So can you speak a little bit about your views about health inequity and how should we address it?
Yes, well, you know, and my one worry sometimes is I feel like these words that we talk about and we, you know, use in the literature can sometimes become buzzwords that lose their original meanings, right? And the original principles that underlie them. So I'm glad that we have a chance to talk about this today. To me, health equity is really about recognizing the core humanity of every human being. Yeah. It's recognizing that every life has value, that every child deserves to have a fair shot at a good life, that everyone is deserving of support, and that all of us shouldn't be judged by our worst moments or our worst mistakes, but that we should be treated with regard to our full potential and our promise. That's what I want for my kids. That's what I want for all of our children. But to really live an approach like that means that we have to, number one, be aware of what disparities exist, right, of which communities are being left behind. That's where data becomes so important. And I know this community is no stranger to the importance of data, but sometimes, you know, in the general population, data can seem, you know, dull or boring or weak, but it's powerful and it's important because it helps us understand what's going on. The other piece, though, that's important here is that the focus on equity should also approach how we think about the folks we care for and how much of their story we dig into, right? The more we understand about equity, we recognize that what drives so many of the disparities are often really far upstream. They often are upstream not just in our communities, but upstream in the life course, right? So the experiences that young children have, which may create trauma for them or which may create more social disconnection for them, those can have spillover effects for years down the line and show up as increased rates of mental illness and physical illness as well. And so understanding the communities that people grew up in, the experiences that they had, to me is a key part of how we focus on health equity. And I'll just give you an example. You know, I was traveling from another city yesterday and I was talking to an incredibly thoughtful, you know, and just really dynamic young man. But he told me, he said in school he was a very promising student when he was growing up. He was very smart at school. But at various points in school, his grades slipped. In third grade, he had a sudden drop in his grades, and people wondered, oh, maybe he's not as smart as we thought he was. And then in seventh grade, his grades dropped again. And then in eighth grade, his grades dropped again. And by the time he got to high school, he was sort of considered a problem kid. Someone who just didn't perhaps have the wherewithal to make it. Teachers looked at him that way. The system looked at it that way. He fell into more and more trouble, ended up getting into trouble with the law, and then ultimately had a tragedy that took place in his own life. But the reason, what I didn't tell you, is about what happened in his life when his grades dropped in all those times. In third grade, his father was incarcerated. He lost the man that he had looked up to. In seventh grade, his best friend was shot and killed. In eighth grade, his sister was shot and killed. Right? And the tragedy he ultimately encountered later was when he himself was shot, right, and paralyzed. Now, if you don't understand that part of his story, and you just look at his transcript and his criminal record, or his experiences with law enforcement, then you start to say, hey, this seems like a problematic kid. Like, why isn't he doing better? Why doesn't he work harder? Like, you might start to fall into those stereotypes, right? But when you understand his story, then you start to recognize, actually, we're not all starting off on equal footing here, but also, if we really want to understand what's happening today, we have to understand how to address what happened yesterday and the trauma that many people are still carrying with them. And systems that are built to do this, educational systems that train healthcare providers and others to understand these deeper stories and probe for them, systems that are set up to address those deeper upstream experiences that impact someone's downstream health. These are the systems that we need to focus on health equity. And the data piece, just to come back to that full circle, becomes important because that helps us understand if we're making progress, right? Because there's a lot of good work happening in the country around equity, and a lot of that good work is happening right here in Cleveland, and a lot of that I know is a priority for the Cleveland Clinic, whether it's your work on addressing lead or addressing infant and maternal mortality or addressing food insecurity. These are profoundly important efforts that are helping and intended to close that equity gap. And the data matters because it helps us understand if we're making progress. Our history is full of examples as a country where we have put money toward things with the best of intentions, but they haven't necessarily generated the results that we wanted. So the data keeps us accountable. So this is how our office really thinks about health equity. We want to bring it to life in the conversations we have and help people realize that perhaps one of the most important lessons we can take from the conversation on health equity is that the lives of other people affects our lives too. That we are not living in a vacuum. And so we should be concerned about children who don't have enough to eat, even if we are fine in our household. We should be concerned if young men like the gentleman I mentioned just now are experiencing violence, gun violence in their day-to-day life and are losing family and friends to this, even if our own family is safe. These are the things we should care about because when our community suffers in one part, it impacts all of us. And if COVID didn't taught us anything, it was that we rise and fall as one community, as one country, and that we cannot move forward as a nation if some of us are struggling, if some of us are sick. We might do that for a short period of time, but ultimately that catches up to us. And truly, this is the lesson that I believe comes to our history, but also that I think very personally, for me, I think of my grandfather when I think about this. My grandfather was a very poor farmer in India. When I say poor, I mean really, really poor. My father's family didn't have enough money to even buy slippers or shoes, so they would walk barefoot. The first time he actually got footwear was when he was 15 years old. I think he got a pair of slippers, and he developed blisters because he wasn't used to wearing something on his feet. Every night around the dinner table, they would dilute the bowls of each child, each of the 6 kids, with more and more water so that they would have enough dal, enough grain for everyone around the table. Times are really, really tough. But my grandfather made it a point to travel to different villages in the community once a year to raise money to build a youth hostel in the village so that other kids could study. And people would sometimes look at him and they would say, "You're so irresponsible. Your own kids don't have enough to eat. And yet here you are raising money for other people's kids. What's wrong with you? Get your priorities straight." To which he would simply respond, "Well, those kids are our kids too." And that is, to me, at the heart of how we need to approach this new chapter of our lives as we come through this pandemic, is to recognize that those kids who may not be our own, those people in our community who may not necessarily be our family, that they are our kids, they are our family too. And when we lift them up, when we help address the deeper underlying drivers of their trauma, of their ill health effects, then we ultimately lift all of us. We lift our entire community. And that's how we will get stronger and healthier as a nation.
Yeah. I couldn't agree more. And part of our community that I believe very much understands what you're talking about, but also lives this day in and day out are people in this audience, our caregivers here at Cleveland Clinic, because as we strive to provide the best care possible for our patients, for their families, we are facing and we're being exposed to this growing complexity of healthcare needs in our community. But it obviously also affects our own caregivers.
Yes.
And I know that one part of your agenda is also to really highlight the stressors for the caregiver community, for healthcare community in the United States. So can you speak a little bit about your efforts and through your office to really educate people that the burnout, the stress on the healthcare providers is immense, it's unprecedented, but also, once again, to speak a little bit about what we can do together to make sure that our healthcare workforce stays healthy as well, because unless we're healthy, we cannot help others being healthy. So please.
Absolutely. Well, I'm just curious, just by show of hands, how many people know a clinician in your life, it doesn't have to be in Cleveland, but a clinician who's experienced burnout? Okay, so almost everyone, and I'd raise my hand too for that. Both as somebody who knows people and someone who's experienced burnout myself. This is incredibly common, unfortunately, and it's become so common that I think it's taken for granted and not fully appreciated for its impact in the broader public. One of the reasons last year that I issued our first Surgeon General's advisory on health worker burnout was because I wanted to call the entire country's attention to the fact that there's a burnout crisis in medicine, and it ultimately is impacting all of us, whether you know it or not. Right? We know that people's access to not just COVID care, but emergency care, primary care, is threatened when 25% of doctors say that they're thinking about and planning to leave their clinical work, when 52% of nurses say that they're planning to leave their clinical work. I mean, these are profound numbers, staggering numbers, really. So what we laid out in our advisory was a series of actions that we felt everyone needed to take, including actions for government to take. But they focused on, number one, protecting our health workers from harm. It just is so painful to think about the fact that 80% of health workers during the pandemic experienced some form of physical or verbal abuse. Right? And I suspect many of you did, and that you know people who did as well. But can you imagine any other industry where 80% of the people experienced abuse? Where that would be taught? I mean, that just would be seen as utterly unacceptable. And then why would you be surprised then that people wanted to change their line of work or didn't want to come back? Who wants to work in an abusive environment, right? And so this is a real profound challenge. So number one, focusing on safety, we said was essential. The second was reducing the barriers to people getting access to the kind of mental health supports that everyone needs. And I don't just mean a care if you're experiencing a major depressive disorder or in the throes of an anxiety attack. I'm talking about the routine care that we should all get before we arrive there, right? But there are barriers to that, some having to do with medical licensure, right? And we know that a significant portion of clinicians still fear that they will be punished by the licensing board if they admit that they had any struggles in the past with their mental health. That's something more and more states are changing, but we are pushing to accelerate that change. The third is we also know that the quality of the work matters too. I've yet to meet a doctor in my own life and my travels who has said, when I was young, I really thought I'd love to become a doctor so I could chart. That'd be incredible. Nobody says that, right? I mean, these are the things we do because we have to, and that there's some of that has to occur. But the extent to which the health records have been designed largely for billing instead of for patient care, the way they've come, the duplication of administrative work has come to dominate the lives of so many clinicians is really profound. And I've been really intrigued though and hopeful looking at some programs, including the University of Hawaii Health System and others, which have really taken an axe to the duplicative, redundant administrative work that gets in the way of taking care of patients and steals time away from being at the bedside. And one of the other big issues we worked on there is related to prior authorizations. Yet another thing that people didn't go into medicine wanting to do, God, if I could just fill out more prior auths, that'd be great. But this is like, a lot of these I fear become barriers that are thrown up, to change or reduce utilization, of a service or a medication. But what they do is they add time and frustration, and they delay care, right? Which also has health consequences. So we've been working with CMS, the Center for Medicare and Medicaid Services, who's actually been very supportive of the idea of putting forward measures to reduce prior authorizations. In fact, there was a proposed rule that they just issued a few months ago in that regard, and now we want to push the private sector to follow suit as well. So we've got to do a lot to improve the quality of the work, to improve the supports to protect and provide for the safety of health workers. But the other piece, last piece I'll just mention, is around community, right? Like, I wonder, I remember being in residency and having such an incredible experience because in part of the people that I was training with. Just extraordinary human beings. People took care of each other. We really loved each other. We were friends. I felt like I was coming to work and we were every morning to be with friends. And we worked incredibly hard. We had really long hours. It was emotionally taxing. But doing it with friends, I mean, as human beings, we can overcome a lot of adversity when we are together. Alone, sometimes even normal amounts of adversity can feel overwhelming. And so, but how much attention do we typically pay in the clinical setting to building that kind of community and connection? I worry not as much, and I think that's an opportunity for us to think about how to build and strengthen the buffers that protect us during times of adversity. We have to do all of these things together, but our goal is really to put this on the map as an urgent priority for the country. This is not just an issue that doctors and nurses should care about. Every American, every policymaker should know that the well-being of nurses and doctors and public health workers and pharmacists and others in our health systems, that they matter for the well-being of the country.
Thank you very much. So before we open it up for questions from the audience, just the last question from me. What would be one message that you would like to kind of share with caregivers here at the Cleveland Clinic?
Well, it's a great question, and I will say that I'm not usually good at one messages because as my team, I told my team the other day, I said, I feel like I'm a long-form guy in a short-form world, But I wonder if some of you feel that way too. But, the most important message that I want to share with you is my gratitude and a reminder of how much our country needs you. And I don't mean that just because of the care that you provide in your clinics and in the hospital. Every time I have the opportunity to come speak with colleagues, it is such a blessing for me because I've had the opportunity to wear many hats during my career. But the one that makes me most proud from a work perspective is that of a doctor, is that of being a colleague with all of you, in caring deeply about the work that brought us to this calling in the first place, which is to ultimately be able to reduce suffering and care for others in need. And we're living at a time where many people have become cynical about our ability to make progress and overcome our problems. They look at the world around us and they see that it feels like we're getting meaner to one another. It feels like we listen less and judge more. It feels like we are out there for ourselves. That's what people see and feel when they absorb the flow of information on the news and through social media. But your examples and your lives speak to a very different reality. You remind us, you remind the country, that there are people who still care deeply about others, that our capacity to serve and to love is still alive and well. And the truth is, there's a lot we have to do to address the challenges we have in our country, mental health, physical health, and even the non-health related challenges. We need better programs and policies to address those. And certainly when it comes to mental health, we know that if we don't address the powerful and profound impact of technology and social media on kids in particular, if we don't address the negative information environment that people are swimming in these days, which makes them feel that everything is broken about the world, if we don't rebuild our connections with one another at a time when 1 in 2 Americans are struggling with loneliness and isolation, if we don't do this, we know that we won't make it. But to do all of those requires us to recenter ourselves on a core set of values. Values that we don't talk about often enough, but which have to be at the heart of what informs our programs and our policies and our practices in our own lives. And those values are kindness and generosity, service and love. The reason we have to talk about these values is because our values are our moral compass. When we're presented with choices, and kids today are facing a dizzying array of choices, of how to communicate, where to spend their time, what to do with their lives. But when we're faced with these choices, what helps us make decisions? It's our moral compass. And if that compass is not clear and signaling us in the right direction, then we will be led astray. I worry deeply when I talk to kids who tell me that they feel like they've been caught up and immersed and almost paralyzed by this hustle culture, as they call it, which is pushing them to pursue fancy jobs, to pursue the three big things that we tell kids are the markers of success: money, power, and fame. But we all know people who are rich and powerful and famous and profoundly unhappy. Right? These are not the keys to success. But yet, how are kids supposed to know where to go? Well, that's where it comes back to this moral compass. And it's why I also feel that this is the time, this moment, when people are worried about the future, when people are feeling cynical and despondent, when despair is on the rise. This is a time for us to double down on those values, to talk about them, but also to live them. Right? And this starts with how we live our day-to-day lives, to reach out to each other with a desire to understand rather than to judge. Do we invest in our relationships? Do we seek to get to know our neighbors, recognizing that many Americans these days don't even know who they're living around, right? Do we build those relationships? But it also has to do with then how we take those values and use them to inform the issues we raise in the public square, the policies that we advocate for, the leaders that we choose to support. This is how values can ripple out and affect the fundamental underpinnings of society if we allow them to. And at a time where it feels like so much divides us as a country, it's times where it feels like somehow things are irreparably polarized. These values that I'm talking about have the potential to bring us back together again, to remind us of who we really are and who we can be in our best moments. So what we need right now in America is a moral reawakening. We need to come back and anchor ourselves to these values. And the reason I started by saying I want to express my gratitude to you is not only because of the extraordinary care that you provide each and every day, not only because of the fact that you did that during the depths of COVID, during the darkest days, when people weren't even sure what this virus was or how contagious it was or how deadly it was. You showed up day in and day out to care for people, remembering the oath that we all took. But it's not only for that reason. I express my gratitude to you because in our journey to build a community and a country that's grounded in these core values and guided by these core values, you stand out as some of the most important moral messengers of our time. People who are so trusted by the public, people who through the force of their example, both in the clinical setting and in the community, can inspire a nation to remember who we are in our best moments. And I could not think of a job that's more important than that, a calling that's more urgent than that one. Because the truth is, this is very personal for all of us, right? Like when I think about my own kids who are 5 and 6, what I want for them is to be able to live in a world where they'll be embraced and supported. I know my kids will make mistakes from time to time. They may say the wrong thing. They may do the wrong thing. All of us will. But I want them to live in a world where if they stumble, somebody will be there to help them up. And if somebody else stumbles, they will do the same. I want them to grow up in a world where people strive to understand their intention, even if their words come out wrong, and where they do the same for other people. I want them to live in a world where they recognize that we are better when we lift one another up, and that we weren't designed to be alone and on our own, but that we were designed to be together. And finally, I want them to grow up in a world where strength is defined differently than how we talk about it today. And I worry that kids today are growing up thinking that strength is about the loudest voice in the room. So the person who can be the most aggressive, the person who can take the biggest bets and the greatest risks. But in my own life, I've seen that that's not what strength is. I've seen that strength is to be found in the kindness of a stranger who reaches out to help somebody who may not have enough, in the generosity of millions of American citizens who, whenever a disaster takes place anywhere in the world, dip into their pockets and give more than any other nation in the world. because that's one of our sources of strength, our generosity. I want them to know that real strength is found in this service that's rendered by people like you, by soldiers, by people in our communities each and every day who wake up each morning asking themselves, how can I make other people's lives better? And most importantly, I want them to know that strength is to be found in love. That word that we don't use often enough, which we sometimes think of as soft. But there's nothing that's soft about love. Right? You think about, who would think about the extraordinary love of a mother or a father for their child, the love that inspires them and compels them to put themselves in harm's way to take care of their child. Who would say that that love is weak? Who would say that the love of a soldier who throws himself in harm's way to protect his fellow soldiers, that love is weak? Love is not weak. It is what makes us strong. It's what bonds us together. It's what allows us to serve, and it's what we need in moments like this. So all of us together need to be part of that moral reawakening, that return to core values. And you do that through your work and your example. And that's why I will always be grateful to you and forever grateful to be a part of our profession.
Thank you very much.